Becoming a mother can be a life-changing experience for a woman. Though it's an exciting time, there can also be fear and anxiety, even depression. Learn how being aware of your own mental health is as important as caring for your newborn baby. From birth to about 2 years old, moms will visit their child's pediatrician's office about 6 to 10 times for well checkups. But what a lot of moms don't realize is that their pediatrician can be a great resource for them too.
Pediatricians are a children's doctor, but taking care of mom is also taking care of baby, because if mom is not well, then baby's not well.
Amy Parks is a licensed clinical social worker with UCSF Fresno. She explains the emotional spectrum of motherhood.
One of the kind of myths of motherhood is that it's easy and that it comes naturally, and that as soon as you have this baby, that you are just going to be filled with this overwhelming love and happiness and, all of that. And for a lot of moms, that is true. But for some, it's not true at all.
Amy trains new pediatric residents in UCSF Fresno's medical education program and sees mothers who are struggling if pediatricians request her services. She describes how visits to the pediatrician's office can play a role in keeping mom on the right track.
In the first year of your baby's life, you're there a lot, sometimes up to 6 times or more. In that first year, so you really develop this really strong relationship with your pediatrician. So absolutely your pediatrician is a safe place to start and just say, hey, this is how I'm feeling, is this normal?
Jana Brewer is a mom of 2 girls. After her first child, she experienced an unexpected feeling.
My anxiety was just through the roof. I was so overwhelmed. I felt like somebody was always sitting on my chest, and I just couldn't breathe.
Though she was over the moon to have her daughter, Jana explains the stresses of being a new mom, along with sleep deprivation, can become very overwhelming. She worked with her own OBGYN, but says having her child's pediatrician support helped too.
Having a pediatrician that is equipped with asking the mom the right questions. One, like, you may not recognize that there's something wrong, and the pediatrician would be able to tell because they're there in front of you.
These symptoms a lot of new moms experience after birth is known as baby blues and typically resolve on their own within a week or so. But if the feelings become more intense and last longer, then you may be experiencing a perinatal mood or anxiety disorder, something 1 in 5 new moms in California experience.
And you can feel really tired and sad and overwhelmed during that time. When it extends beyond those 2 weeks, and you just don't feel like yourself. Sometimes that's how it's described. I just don't feel like myself.
Mental health help is scarce in the Valley, which has less than half as many psychiatrists per capita as the rest of California, which is why Amy says it's crucial pediatricians are trained to recognize the signs when mom brings in her baby. Pediatricians use a screening tool to help catch the signs. However, it's important for moms to discuss the feelings they're experiencing with their pediatrician, even if they think the questions don't pertain to them. Jana says she hopes mothers speak up if they're ever feeling off.
Don't be afraid. Everyone goes through it, but everyone's emotions and you feel everyone's experiences are different. Don't be afraid to talk to the people around you. Don't be afraid to reach out to your doctors and just ask questions or seek care.
Be self-aware, to have an awareness of what is happening for us all the time. There's so many different things that can affect our mental health and our wellness, and so I think having a really good insight and understanding of what makes you tick and how you are, and really noticing when things are off a little bit.